substance misuse, mental health, and trauma from unnecessarily interacting with the legal system and make sure that they get the care they need instead of hitting the legal system.
A common question that comes up is how much funding is available. The total amount available for this funding area currently is 15.1 million, and this includes about 4.8 million that's allocated exclusively for the city. Perez, can you share some of the themes from community that inform this call for proposal?
Sure. And I'll just answer. Some people do ask why does the city? And part of our ordinance requires that a minimum of 10% of the sales tax revenues every year in this space has to go back to the city. So that is why a minimum of 4.8 million has to go back to the city. But what we're really looking for in this, and again, if you look at the call for proposal, really look at the key considerations and some of the other parts, but it's really about diverting people with mental health and substance misuse from interacting with the legal system. Or if they've hit the legal system, how do we help them transition to community? And again, it's really what is that mental health and or substance misuse care that is going to help keep them stable. And then really, we're looking for organizations that have demonstrated trust and experiencing working with this population. We are looking for solutions that utilize peer support specialists and really value that lived experience. We also know within this population, folks that have hit the legal system or likely to hit the legal system, there is a high substance misuse and the severe and persistent mental illness need. And so we do have a focus and are always looking for those proposals that focus on, not to the exclusion of mental health, but are really looking to address those substance misuse needs and how do we help folks that have that severe and persistent mental illness from just circling through all the systems? What can we do differently? And again, as we said, a portion of our funding is required to be awarded to the city for things like STAR, co-responder.
Got it. What are the desired impacts or outcomes of the programs that we're looking to fund?
Yeah, we're really looking to reduce substance misuse or improve or maintain positive mental health for individuals who are at risk of or currently involved with or exiting the legal system, and looking for that increased equity in mental health and substance misuse outcomes for individuals who are at risk of entering. So it is really pretty straightforward, reduced, improved substance misuse and or improved or maintained mental health.
Okay, well, with that, I'd like to open it up to the chat.
Yeah. And as we're waiting, because we always know it takes a moment for those chats to show up, if you have questions, you can always reach out to us. During this open period, I'm the one that you can talk to so that we keep it consistent and fair and nobody gets advantage. And so my email is lorez@caringfordenver.org. Kendall will drop that in the chat so that everybody has that. Or if you have questions about the application process, then that would be Tish. And Tish would be tish@caringfordenver.org. And then I'm trying to think about what are some common questions. Be thoughtful as you make your requests about the total amount available. Like as Ramel said, there's 15 million with a minimum of 4.8 going to the city. So think about your size of your request relative to what we get. We've, in this current economic time where we've seen reduced funding at the state, federal, and city levels, we've seen an increase in the number of proposals and requests coming to us. And unfortunately, we can't fund them all. But that's why we really, think about what you're asking relative to the amount that we have. Ramel, are there any other sort of things that you want to highlight as we're waiting to see if there's any questions?
Something that is always important to me is the clarity that a proposal speaks to the specific mental health and substance misuse needs of the population that is to be served, and then why the proposed intervention fulfills that need. That always makes it, that's always helpful in terms of understanding what success looks like. And so I think really being able to hone in on those different elements is always important and valuable. Those pieces follow up with our due diligence and the site visit. So that's something I definitely would like to highlight.
Yeah, no, appreciate that. What I'll just add to that too is really that intentionality. Sometimes we'll see, well, if we do this one thing, one of the byproducts will be this mental health or substance misuse. But
Mhm.
really, the intervention itself should be about that mental health or substance misuse. And I think that's an important thing that the program officers always lift up.
We do have a question. Residential facility and group home nonprofit here. Did I read correctly that constituents served can be residing in Denver County through your facility and still qualify to be funded versus constituents had to originate from Denver County?
Yeah, Christina, that's a great question. I think so. Where they are residing or living, especially when we talk about folks coming from being unhoused or coming from the legal system, where they reside, where they live, is where they are residents of. So the facility or group home, if it's in city and county of Denver, then we count them as Denver residents. Um, they don't necessarily, I mean, if they originate from Denver and they're still in Denver, that's great too, I think. But we know that what we count as, and there's more description of that on our frequently asked questions as well as I believe it's also in the call for proposal, talks about how what qualifies as a Denver resident, and it's mirrored after what the city does. So hopefully that answered your question. Again, if we didn't quite get it right, chat back and make sure.
Another question is, are there any major changes in this round of funding in terms of what you are and are not looking for in an application?
I don't know if there are major changes, but I think in both the application and the call for proposal, we're trying to have you be more specific about what is that mental health and substance misuse intervention. So I don't think there are major changes. Again, we are, as we learn more, we're really trying to understand that intervention. I think, we learn more into what the priorities are. So, peers work, that ability for people to stay in care even after they get it, stay connected to. I think looking for, again, folks with severe and persistent mental illness, looking for folks that are trying to address that and substance misuse and mental health. And how are we really diverting people away from the legal system? Ramil, would you add anything to this? No.
Not really. I think it's, just emphasizing the part that the name change came because we're trying to be more clear. But the content of this funding area is the same relatively, right? That we're just really focusing in on that what interventions are addressing the trauma, the mental health, or the substance misuse issues of the populations that lead to certain outcomes that we're able to really see and understand how those were mitigated to some degree. Another question here. The organization I write for, was told by C40 staff to apply for the cycle, though they have an active grant with Alternatives to Jail. We were told to apply for a diff. That's where the question ends.
I think a different population, youth versus adults. We just want to confirm eligibility. So that's a little hard to completely answer. So I would suggest following up with us. So, again, when you apply in youth or our community centered, we look at what's the population you're seeking to serve. And so if you applied in one of our other cycles and what you said is we want to work with a population that has hit the legal system, then we would have said apply for Alternatives to Jail. I think we'd want to understand, to be perfectly honest, what is your current grant and what this would be different than, to make sure you can measure. We could understand how, what is the intervention? Is it a different population? How would we measure it? Does it make more sense for you to apply now or when this grant is, the current Alternative to Jail grant is renewing, that then you talk about an expansion there? So that wasn't a clear answer. I get that. But what I'd say is, why don't you reach out to me and we can talk through the specifics, and I can One, you are always eligible to apply. You can apply for one grant, receive one grant during the year. And so everybody can apply that wants to apply, but we want to make sure you're using your time well. So please follow up with me if you can.
Got another one here. Does this grant support mentoring as an intervention for prevention?
That's a great question. And we know mentoring is important for that engagement. And mentoring itself is not a mental health or substance misuse intervention. And so I think, we want to understand, well, I shouldn't say it's that universally the way I just said it. We'd want to understand what's the therapeutic element, or where and how is mentoring being lifted up as a mental health or substance misuse intervention. That sort of prevention wellness is a little harder if it's not intentional about mental health or substance misuse. I'm going to let Ramel take a cut at this as well, because he has a great view on this.
Yeah. Essentially, it goes back to what's that mental health or substance misuse need that's being expressed by the population. And then why is mentoring, and how is that specifically tailored to address that need, rather than the broader general pro-social benefits that come from it. An example that I use often is, I'm a mentor myself, but the way that the program is structured wouldn't necessarily qualify, because it's not intentionally focused on the improvement of my mentee's mental health or reducing his substance misuse. So really going to Loreza's point about that intentionality, and also when she mentioned earlier that we're really looking for outcomes that are not a byproduct of. It's really that A to B, that we're doing this thing that fulfills this specific need, as opposed to by providing this, or in the terms of the question, prevention, thereby, their mental health is improved or the substance misuse is reduced.
So Jackie, hopefully that answers your question. Again, if you have more, you can always follow up with us as well. Sometimes we're asked, what is that right size of grant? And I'm just going to say there isn't necessarily a right size of grant. We won't ever fund more than a third of your organizational budget. We look at that as a way not to jeopardize your nonprofit status over a period of time. If any funder is too much of your funding, that can be at risk. But we also we want to create sustainability in what we fund. So just important to think about, again, what is the size of your organization's budget? What is the size of this program? Because again, we're a programmatic funder. So I know there is a love and a desire to be more general operating. Can't we, if we're working in this space, can't we just write a general operating grant where you're going to fund a little bit of everything? And unfortunately, because of the way our ordinance is written, we are a programmatic funder. So it means what are the costs relative to this program you want to run for mental health and substance misuse in the city and county of Denver? And then the other clarity I'll add that we sometimes see people get confused. This is not a Metro Denver. So it is not the sort of bigger than, it is only the city and county of Denver. Ramel, anything else that you think about that people have raised questions for you about?
No, not off the top of my head.
We'll try to think of a couple more things. Okay.
We do have another question, so that's very helpful. Will the fund support a mental health specialist for those we mentor and work with in small groups who need more mental health specialized support?
Well, I can never guarantee funding. That is potentially more aligned, more intentional. I think the important thing to think about is what we've learned in some of this is, how do you really integrate that mental health specialist to build trust with the mentor and the small groups? And so it's not just you can have this position, but really thinking about how do you operationalize that to really ensure that take up of those mental health supports that folks need it. How do you make sure that whoever, for those folks you are mentoring, how they feel safety and trust and feel respected by that mental health specialist. So, but yes, that is more in line with what we might fund. Just to sort of also give some details as you all are thinking if there's additional questions, because again, we only stay on as long as you have questions. And it doesn't mean you can't follow up with us again afterwards with any questions, but the proposals are due May 6th by 5 p.m. If you're new to our grant system, you have to register May 4th by 5 p.m. So if you've ever applied for a grant, you are registered. But just make sure it all works and you can do that. Make sure that it's all registered and you have sign in by May 4th. We will notify about who is awarded late July. And usually these grants would have a start date of August 1st. And then some things we won't fund. I mentioned general operating. Facilities capital, we don't do fellowships or scholarships. And then we also don't fund programs that require membership in a specific religion or seek to advance a particular religious faith or belief. Basically, we're always looking for organizations that will serve all comers. And again, you can ask for anywhere from 1 to 3 years in your grant proposal. What you want to be thinking about is, this is a question that we get sometimes a lot, is that, is this brand new? Is this a pilot? Do you know what the cost will be in year 2 or 3? If the answer is no, then maybe you apply for 1 or 2 years, because what you can't do is come back to us if you've asked for a 3-year grant and say, hey, I didn't ask for enough money. Can you add to this? So really being thoughtful about what can you predict over 1, 2, or 3 years. So it's great as a nonprofit to know you have a 3-year grant coming in, but not if it doesn't cover the full cost of the programming. And part of what we're working with you to learn is what is the right programming? What are those right supports? So really thinking about what is predictable and known to you about the program you are seeking or lifting up. Raymel, would you add anything to that?
No, I wouldn't.
Okay. All right. Well, I don't want to keep on just talking at you. Again, if there are questions on the call for proposal or eligibility, you can reach out to me at lorez@caringfordenver.org.
We do have another question that popped up.
Yeah.
Our core educational and therapeutic programs are funded via fee-for-service, but to approach our constituents holistically, we incorporate experiential therapies, community engagement, workforce training, etc. Could we propose several smaller programs to fund that are not covered in fee-for-service?
And Christina, we should follow up. I'm going to answer this question the way I think I'm reading it. Again, what we fund are those therapeutic programs. So sometimes as you're lifting it up, before you can get fee-for-service or you get reimbursed by Medicaid or another partner, you might need funds for us. But the community engagement workforce training would fall outside of what we can fund. So again, we know those are important. We know those are social needs. And our ordinance is pretty specific about mental health and substance misuse programming. And as an example, in our last funding area in youth, we got 53 million in proposals, 130 proposals for $53 million, and we had 13 and a half and could fund 40. And so if we were to start lifting up and funding more of the social needs, I don't know that we could handle the flow. And so as we've done our community engagement, what people have told us is that access to care and that access to safe and trusted care is still one of the greatest needs. And so that's what we're going to exhaust first. So that's why we're really focused on the therapeutic programs. I'm not answering the experimental therapies because I'm not exactly sure what that incorporates. And I don't want to say a universal yes, but if there are you can follow up with questions around these are the kinds of things. And then could we propose several smaller programs to fund that are not covered by fee-for-service? If they're related to mental health or substance misuse specifically and intentionally, sure.
One thing that I would add to that is just, Lorez, when you said we're going to focus on those therapeutic services, I want to be clear to draw the distinction. That does not mean only licensed clinicians. Mm-hmm. And so, like she mentioned at the top of the call, peer support specialist is really the focusing in on the intentional mental health and substance misuse services. And so we count all of that under the umbrella of therapeutic.
Mm-hmm. And it might be art therapy. It may be other ways that you need to engage people into eventually one-on-one if they need more, or not, and you want to stay in that sort of group space, or think about what are those ways you engage, as Ramel said, and what are those right team and support that build trust. So again, we talked about peer specialists as a category, but just as a reminder, peer specialists are peers, so people with lived experience that have been trained in supporting people, connecting them to care, and keeping them in care, because they have been trained to protect their own sobriety and mental health while they support others in theirs. And they have a clear scope. And so how they sort of really help keep people connected to care is important. And we see that as important in that continuum. They're not licensed, as Ramel talked about, but they're an important part of that care continuum. And so how we think about it, it's different than peers. And so I want to be very careful when we say peer specialists. They have training. They don't always need a certification, but they've gone through training so that they can protect. Peers are important generally, but that's it. They are not necessarily trained in supporting people in recovery on that mental health and substance misuse space. So we really distinguish between peers and peer specialists. So I just want to make that clear too. All right. Well, we'll make sure again we put some of the dates that we talked about in the chat as well. You can always reach out to us with questions. Again, if you have a current grant, please don't reach out to your program officer. Well, you can, they'll just send you back my way. This is sort of our alignment with procurement practices at the city. We can't give advantage to anybody when it's open. So I am the one that gets to talk to everybody. So you get to spend time with me. So happy to talk to you if you have questions. And again, even as we answer questions and try to give you a sense of what is aligned or better aligned with what we funded, it's important to remember we can never guarantee funding. The other thing I would encourage you all to do is look at what we funded in the past too, especially over the last 2 years in this alternatives to jail space. Just it gives you a sense of what are some of the programs that have been awarded. And we'll just give a minute or two more, but what I'd love to say again is we appreciate all the work you're doing, whether we can fund you or not. That doesn't diminish the important work you do to serve our community and to serve this community that tends to hit our legal system. High needs, and it does take a village. And unfortunately, we always just have limited funds. But are grateful for the time you spend with us here. We're grateful for what you do for community. And just really want to thank you for everything that you do. And thank you for joining us today.
Thank you.